Hello and welcome to Creators Crib. I am Bimisola Oluwatosin, the curator at Pioneer Medical Initiative. In today's course, we'll be talking about HIV testing. What is HIV testing? HIV test is a way to find out if you have the HIV virus. There are different types of tests, but they all generally involve taking a sample of your blood or oral fluid. What are the types of HIV tests? We have the blood test and the rapid test. The blood test, which is most common, uses blood drawn from a vein in your arm, and then the rapid test uses a finger prick blood sample or oral fluid swab. The result may be available in minutes. For the blood test, you would need to visit a clinic or a lab, make an appointment, or visit a clinic lab that offers HIV testing, and then you undergo registration and counseling. You likely fill out forms and have a confidential chat with a healthcare worker about HIV and the tests. Rapid tests. This can be done in the clinic or at home. The rapid test can be done at a clinic or with a home test kit. It involves finger prick. For a clinic test, a healthcare worker will prick your finger with a small lancet to collect a tiny blood sample. Home tests often use a similar finger prick or might involve an oral swab. The blood or oral fluid is applied to a test cassette according to the specific test instruction. Depending on the test, results are usually available within 15 to 20 minutes. The rapid HIV test kit, it includes a test cassette, a sterile lancet for blood collection, alcohol swabs for disinfection, a sharp container for safe disposal of used lancets, and a buffer solution to activate the test. Pre-test counseling. This crucial initial step establishes informed consent. The healthcare provider discuss the testing process, potential application of both positive and negative results, and address any anxiety or concerns the client may have. Hand hygiene. Meticulously hand wash with soap and water. It is paramount for both you, the healthcare provider, and the client to minimize infection risk. Finger prick. A sterile lancet is used to prick the client's fingertip to obtain a small blood sample. Sample application. The prescribed amount of blood is carefully dispensed onto the designated area of the test cassette, ensuring accuracy and avoiding contamination. Buffer addition. The specific buffer solution provided in the kit is added to the test cassette according to the manufacturer's instruction. This activates the test and initiates the antigen-antibody reaction. Result incubation. The test cassette remains undisturbed for the designated time frame, usually between 10 to 40 minutes, for interpretation. Each rapid test cassette has specific designated lines indicating positive and negative results. It is critical to strictly adhere to the manufacturer's instruction for accurate interpretation. Generally, for the positive result, two distinct lines appear, one control line and one test line. This indicates a potential HIV infection. However, a confirmatory test is mandatory for a definite diagnosis. Negative result, only the control line is visible. This suggests no detectable HIV antibodies at the time of testing due to the window period, that is, the time between infection and antibody development. A negative result doesn't definitely rule out HIV infection. Pre-testing counseling. Pre-testing counseling is a cornerstone of responsible HIV testing. It establishes a foundation of trust and empowers individuals to make informed decisions about their health. Maintaining confidentiality and ethical support. Confidentiality is paramount. All information disclosed during counseling is protected according to ethical guidelines and local regulations. This builds trust and encourages individuals to seek testing and care without fear of stigma or discrimination. We've come to the end of this course. See you in the next course.